Since the dawn of civilization, humans have been fascinated by the idea of living forever. Over the past century, advances in medical science, public health, and social policies have dramatically increased our average lifespan. But as we celebrate these achievements, a new question arises. Are these extra years truly spent in good health? This video explores the evolving debate between lifespan, the total years we live, and health span, the years we live free from chronic disease or disability. As we dive in, we'll see why the focus is shifting from simply living longer to living better, and what this means for individuals and societies worldwide. Lifespan refers to the total number of years a person lives, while health span is the period of life spent in good health, free from chronic disease or disability. The distinction between these two concepts is crucial. While medical advances have extended our lifespans, many people spend their later years battling illness or disability. This has sparked a global conversation. Should our goal be to add more years to life or more life to our years? Understanding these definitions sets the stage for a deeper discussion about the quality versus quantity of life. Just a century, global life expectancy has more than doubled, from around 35 years to over 72 years today. This remarkable achievement is thanks to breakthroughs in medicine, sanitation, and nutrition. Diseases that once claimed millions of lives are now manageable or even preventable. However, as people live longer, new challenges emerge. Chronic diseases, frailty, and disability often accompany these extra years, raising concerns about the true benefits of increased longevity. The longevity revolution has brought both triumphs and dilemmas, prompting us to rethink what it means to age well. The world's population is aging rapidly. In 2020, there were 1 billion people aged 60 and above, making up 13.5% of the global population. By 2050, this number is expected to reach 2.1 billion. This demographic shift presents significant challenges for healthcare systems, economies, and social structures. As more people live into old age, societies must adapt to meet their needs. The question is not just how to support longer lives, but how to ensure those years are healthy and fulfilling. This shift demands new approaches in policy, healthcare, and community planning. As lifespans increase, chronic diseases such as heart disease, cancer, diabetes, and respiratory illnesses have become the leading causes of death worldwide. These conditions often result in long periods of disability dependence and reduced quality of life. The economic impact is staggering, with trillions lost in healthcare costs, lost productivity, and reduced labor force participation. The rise in chronic disease highlights the urgent need to focus not just on living longer but on living healthier. Addressing this burden requires coordinated efforts from individuals, healthcare providers, and policymakers. Implications of an aging population extend far beyond healthcare. Prolonging life without improving its quality places a heavy burden on families, caregivers, and social support systems. It can also widen social inequalities, as those with better access to healthcare and resources enjoy healthier, longer lives, while disadvantaged groups face more years of poor health. Policymakers must consider these factors when designing interventions, ensuring that efforts to extend lifespan are matched by strategies to enhance health span and reduce disparities. Preventive care is essential in the quest to extend health span. By focusing on early detection, healthy lifestyles, and risk reduction, we can delay the onset of chronic diseases and promote healthier aging. Preventive strategies include regular screenings, vaccinations, healthy diets, physical activity, and stress management. These measures not only improve individual well-being, but also reduce the overall burden on healthcare system. Shifting the focus from treating illness to preventing it is a key step toward ensuring that longer lives are also healthier ones. Recent advances in geroscience, regenerative medicine, and epigenetics have deepened our understanding of aging. Scientists now know that genetics, environment, and lifestyle all play roles in determining both lifespan and health span. Research into gene regulation, cellular repair, and personalized medicine offers hope for delaying the onset of age-related diseases. While there is still much to learn, these scientific breakthroughs are paving the way for interventions that could help more people enjoy longer, healthier lives. Epigenetics is the study of how environmental and behavioral factors can influence gene expression. This emerging field has shown that our choices, such as diet, exercise, and stress management, can actually affect how our genes function, impacting both our health span and lifespan. By understanding these mechanisms, researchers hope to develop personalized interventions that promote healthy aging and reduce the risk of chronic disease. The promise of epigenetics is that we may have more control over our aging process than previously thought. While medical interventions have extended life for many people with chronic conditions, they often focus on managing symptoms rather than curing diseases. This can lead to prolonged periods of frailty and dependence, rather than full restoration of health. The challenge is to develop treatments that not only extend life but also preserve function and independence. Balancing these goals is at the heart of the lifespan versus health span debate, and it requires ongoing innovation and collaboration across disciplines. Not all countries experience aging in the same way. In developed nations, technological innovation and preventive care have helped extend both lifespan and health span. In contrast, many developing regions struggle with limited healthcare resources and traditional practices, resulting in modest gains in lifespan without corresponding improvements in health span. These disparities highlight the importance of equitable access to healthcare and the need for global cooperation to address the challenges of aging populations. The quest to extend human lifespan raises complex ethical and existential questions. Some worry that advances in medicine could create a two-tiered system where the wealthy enjoy longer, healthier lives while others are left behind. Others question whether indefinite life extension is desirable, arguing that it could disrupt the natural cycle of life and strain planetary resources. These debates remind us that the pursuit of longevity must be balanced with considerations of fairness, sustainability, and the quality of life. As people live longer, the process of dying has become more complex. Modern medicine can sometimes prolong life at the expense of comfort and dignity, leading to prolonged suffering. Reports suggest that many patients experience inadequate care at the end of life, due to both errors of omission and commission. Improving end-of-life care requires better training for healthcare professionals, updated regulations, and a renewed focus on compassionate, patient-centered care. Ensuring dignity in dying is an essential part of the health span conversation. The concept of compression of morbidity suggests that it is possible to compress the period of illness and disability into a shorter time at the end of life. By delaying the onset of chronic diseases and maintaining function for longer, people can enjoy more years of good health before a brief period of decline. This approach aims to maximize both lifespan and health span, reducing the burden on individuals, families, and healthcare systems. It's a goal that requires collective action and innovative thinking. Better measure population health, the World Health Organization introduced healthy life expectancy, or HALE. This metric estimates the average number of years a person can expect to live in good health, taking into account the onset and incidence of chronic diseases. Current estimates suggest that about 20% of life is spent in poor health. HALE provides a more nuanced view of population well-being and helps guide policies aimed at improving both lifespan and health span. Lifestyle medicine is an emerging discipline focused on preventing and treating chronic diseases through healthy behaviors. This approach emphasizes the importance of diet, physical activity, sleep, stress management, and social engagement. Research shows that adopting healthy lifestyles can increase longevity and compress morbidity, allowing people to live longer, healthier lives. Universities and medical schools are beginning to recognize the value of lifestyle medicine, training future professionals to help individuals and communities make better choices. Successful aging involves three main components: avoiding disease, maintaining cognitive and physical function, and staying engaged with life. These principles outlined by Rowe and Kahn form the foundation for a disease-free, healthy aging process. By focusing on these areas, individuals can enhance their health span and enjoy greater independence and vitality in later years. Communities and policymakers can support these goals by creating environments that promote active, engaged living for all ages. Social, intellectual, and physical engagement are crucial for healthy aging. Staying connected with others, participating in meaningful activities, and continuing to learn can all contribute to longer, healthier lives. Social support networks and age-friendly communities play a vital role in helping older adults remain active and independent. Encouraging engagement at every stage of life is key to maximizing health span and improving overall well-being. Despite the benefits of healthy aging, many barriers remain. These include limited access to healthcare, socioeconomic inequalities, and environments that do not support active living. Legal, organizational, and economic obstacles can also hinder the delivery of high-quality care, especially at the end of life. Addressing these barriers requires coordinated action from governments, healthcare providers, and communities to ensure that everyone has the opportunity to age well. Ill health comes at a high price, not just for individuals but for societies as a whole. In 2017, the global economic cost of ill health was estimated at nearly $12 trillion, or 15% of the world's GDP. Over the past 2 decades, the combined costs of healthcare, lost productivity, and reduced labor force participation have reached $47 trillion. These staggering figures underscore the importance of investing in strategies that promote health span and reduce the burden of chronic disease. Artificial intelligence, AI, is poised to revolutionize healthcare and extend health span. By analyzing vast amounts of health data, AI can help identify risk factors, enable early diagnosis, and personalized treatment plans. AI-powered tools can also support customized lifestyle interventions, helping individuals make choices that promote healthy aging. As technology advances, AI will play an increasingly important role in optimizing care and extending the years we spend in good health. Personalized medicine tailors healthcare to individual needs, taking into account genetics, lifestyle, and environment. This approach allows for more effective prevention and treatment of chronic diseases, potentially extending both lifespan and health span. Advances in genomics, data analysis, and wearable technology are making personalized interventions more accessible than ever. By focusing on the unique needs of each person, healthcare providers can help more people achieve healthy, fulfilling lives. Quality sleep and effective stress management are essential for healthy aging. Poor sleep and chronic stress can increase the risk of chronic diseases, impair cognitive function, and reduce quality of life. Lifestyle medicine emphasizes the importance of sleep hygiene and stress reduction techniques, such as mindfulness, relaxation, and regular routines. By prioritizing these aspects of health, individuals can support their bodies and minds as they age. Balanced diet and regular physical activity are cornerstones of healthy aging. Research shows that good nutrition and exercise can prevent or delay many chronic diseases, improve mental health, and enhance quality of life. Communities can support these habits by providing access to healthy foods, safe places to exercise, and programs that encourage active living. Small changes in daily routines can have a big impact on health span. Staying mentally active is just as important as physical health and aging well. Activities like reading, puzzles, learning new skills, and social interaction help maintain cognitive function and reduce the risk of dementia. Lifelong learning and mental stimulation are key components of a long and healthy life, Encouraging older adults to stay curious and engaged benefits both individuals and society. Governments and communities play a vital role in promoting healthy aging. Policies that support preventive care, invest in research, and ensure equitable access to healthcare can help extend both lifespan and health span. Age-friendly infrastructure, social support networks, and workplace accommodations are also important. By working together, society can create environments where everyone has the opportunity to age with dignity and vitality. Raising public awareness about the importance of health span is essential. Education campaigns can inform people about healthy lifestyle choices, the value of mental resilience, and the benefits of community engagement. By empowering individuals with knowledge, we can encourage proactive behaviors that support healthy aging. Public health messaging should be accessible, inclusive, and tailored to diverse populations. Looking ahead, technology and research will continue to shape the future of aging. Innovations in artificial intelligence, genomics, and regenerative medicine hold promise for extending health span and improving quality of life. Ongoing research into the connections between lifestyle genetics and aging will guide new interventions and policies. The goal is to ensure that advances benefit everyone, not just a privileged few. Debate between lifespan and health span is not about choosing one over the other, but about finding the right balance. Extending life is a remarkable achievement, but it must be matched by efforts to ensure those years are healthy, meaningful, and independent. By focusing on prevention, equity, and innovation, we can create a future where longevity is a blessing, not a burden. The challenge is great, but the rewards for individuals, families, and societies are even greater. Imagine a world where people not only live longer, but also enjoy vibrant health, independence, and purpose throughout their lives. Achieving this vision requires action at every level, from individuals making healthy choices to communities fostering engagement to governments enacting supportive policies. By working together, we can ensure that the additional years gifted by modern medicine are filled with vitality, dignity, and joy. The journey toward healthy aging is ongoing, but with commitment and collaboration, it is within our reach.